nurse instructor at HAAD DHA Coaching Center. Are you preparing for nursing exam? And are you really struggling to attend the classes and passing the exam? Please attend this online crash course. We conduct online as well as offline crash course. This is a part of online crash course. So first I will discuss placental abnormality. Out of that, two major conditions, very important condition, that is placenta previa as well as abruptio placenta. Placenta previa, it is low-lying placenta, whereas in abruptio placenta, it is premature separation of placenta. Usually after fertilization, the fetus start to grow. Along with that, placenta will start to form. Almost within 12th month of gestation, placenta completes its formation, and usually that will be found in the upper lateral anterior portion of the uterus. And placenta usually helping the fetus to gain all nutritious things, oxygen as well as all necessary items from the mother to the fetus. And placenta usually get detached during delivery, that is the end of labor. Once the baby is out, then the placenta will start to expel, or the placenta will separate from the uterine cavity and will come out. That is a normal thing. But what happened in placenta previa? Instead it gets implanted in the upper portion, it start to implant in the lower portion. Okay, so placenta usually it's get implanted in the upper lateral anterior portion of uterus, but here in placenta previa it get implanted in the lower portion of uterus. In abruptio placenta, what happens? Placenta start to separate before delivery. Usually these two problems happens after 20th week of gestation. So just imagine when placenta start to separate during antenatal period, what happens? Fetus will not get adequate necessary thing, oxygen, minerals, nutrients from the maternal blood. So it will cause damage to fetus as well as the mother. When the placenta start to separate, it causes bleeding. Now look at the signs. Placenta previa produces bright red vaginal bleeding. When the mother mobilizes or when she performs any kind of activities, placenta produces bleeding. So the mother can easily identify bright red bleeding. And whereas in abruptio placenta, when the placenta starts to separate from uterine cavity, it always causes bleeding. And the amount of blood which came out from the placenta, it always forms a hematoma and it is considered as concealed bleeding, whereas the blood is not easily coming out. So the uterus will fight against that and uterus will start forming uterine contractions. So the mother can experience uterine contraction. When you assess the uterus, you can feel the tender-like abdomen or contracted uterus. But whereas in placenta previa, uterus will be very soft and there won't be any pain. But in abruptio placenta, there will be pain. So what are the basic difference? In placenta previa, bright red vaginal bleeding. In abruptio placenta, brownish bleeding and spotting. Uterus will be always soft in placenta previa, but uterus will be rigid or board-like appearance in abruptio placenta. Placenta previa can be easily identified, but abruptio placenta can also identified, but it will not be as faster as placenta previa. How do we manage these two conditions? Normally, both of these conditions are managed according to gestational age, well-being of the fetus as well as the maternal condition. Apart from that, placenta previa is also managed according to the level of placenta previa or types of placenta previa. There are three kinds of placenta previa. Number one is marginal placenta previa. So what happens in marginal placenta previa? The placenta only lies in the marginal area of internal os. Whereas in partial placenta previa, what happens? Placenta covers the internal os partially. But in complete placenta previa, placenta covers the internal os completely. Clear? So, placenta previa is managed according to these three types.
So when you get a placenta previa mother, you have to admit the mother in the hospital and regular assessment is required. And management of placenta previa always varies according to presence of bleeding and without presence of bleeding. So to identify the depth of bleeding and to identify the fetal distress, you can assess the maternal vital signs and fetal heart rate. And very important point is no vaginal examination is performed or permitted in case of placenta previa, because when you start performing vaginal examination, it stimulates the placenta and there may be chances to get a bleeding. So no vaginal examination, no insertion of any internal catheters in a patient with a placenta previa. And next, you have to get an access and blood need to be collected and sent for cross matching and keep ready at least 1 pint of blood so that suppose if patient develops any kind of bleeding problem, again easily we can manage. And IV access is also very important, and that you can start IV fluids. Okay, so because what happens in this situation, it causes bleeding and it can end up with hypovolemia. So in order to prevent all those complications, getting an IV access and starting fluid is also very important. And managing this condition based on the quantity of bleeding, how much does the mother bleed? Okay, so based on that, the treatment varies. If patient is continuously bleeding, so the situation is considered as an medical emergency. But if there is no bleeding, yes, you can consider this as not completely normal, but you can start giving treatment electively. And fetal maturity you have to assess, and if fetus is not completely matured, you can wait till the fetus reaches our maturity time, and you can continue the pregnancy. And once the mother reaches at a term or the fetus reaches a term, then elective cesarean section or normal vaginal delivery are permitted. Clear? So this is how you need to manage placenta previa.
In terms of abruptio placenta, you have to look for two things. Number one, fetal well-being. For that, monitor fetal heart rate, and you have to make sure that this particular fetus is not having any signs of fetal distress. Apart from that, you have to check vital parameters of mother. Why? Because bleeding can cause hypovolemic shock for mother, as well as it can cause fetal distress. Continuing the pregnancy till the term is very, very important. Otherwise, you have to admit the mother and continuously observe the mother as well as the fetus. And if there is no signs of fetal distress identified and maternal compensation is also up to the mark, you can continue the pregnancy. Otherwise, emergency cesarean or normal delivery is required. Please make sure that there is no signs of fetal distress, and please take measures to prevent fetal hypoxia.
Now we will practice some questions. Here is the first question. A woman who is 22 weeks pregnant has the routine ultrasound performed. The ultrasound shows that the placenta is located at the edge of cervical opening. As the nurse, you know that which statement is false about this finding. So what is the meaning of this question? A female who is pregnant 22 weeks and has a routine ultrasound performed and which shows placenta is at the lower area, that is indicating marginal placenta previa. Okay, so what statement is wrong or it is false based on marginal placenta previa? Okay, so we have to remove the wrong answers Okay, fine. So try to remove wrong answers from here. See, we need to select a false answer. That is the correct answer. False answer. You need to select the false statement. Okay, so please remember this. You need to select the false statement. Okay, fine. So the first option, this is known as marginal placenta previa. That is a correct statement. Okay, so we don't require this as answer. So we will remove A. And second is the placenta may move upward as the pregnancy progresses and need to be re-evaluated with another ultrasound at about 32-week gestation. Even this is also a better statement or a true statement because marginal placenta previa usually treats by itself, and as the day advances or as the gestational age advances, there may be chances to get a movement of placenta a bit upward so that it doesn't require any treatment. Okay, so this is a true statement regarding marginal placenta previa. C is the patient will need to have cesarean section, cannot deliver vaginally. Not mandatory. Basically, for a placenta previa, it is not mandatory to only perform cesarean section. Even normal vaginal delivery is also possible. But if in case of complete placenta previa, yes, regular routine vaginal delivery may not be possible. Okay, because when the contraction starts, there may be chances to get detachment of placenta first, and it can cause problem to the fetus. So this is not the correct statement. So this is a false statement. And so we'll see. We have to make sure that even D is also wrong. So the woman should report any bleeding immediately to the doctor. Yes, this is a true statement. Okay, so true statement we want a false statement. Okay, so C is the false statement, so we will select this as answer. Clear? So what is the answer? C is the answer. Clear? So we'll discuss one more question. You are performing head-to-toe assessment on a patient admitted with abruptio placenta. Which of the following assessment finding would you immediately report to the physician? Okay, so client with a abruptio placenta, the following need to assess first. So that is the question here. Clear? Oozing around the IV site, tender uterus, hard abdomen, vaginal bleeding. Out of this, which one is the correct answer? So what is the situation here? This is a condition, abruptio placenta. Okay, so basically what is abruptio placenta? It is placental separation will happen before normal, the time of delivery. It happens during the pregnancy period. Okay, and one of the complication of abruptio placenta is DIC. So usually for a client with the abruptio placenta, there may be chances to get DIC. It's disseminated intravascular coagulation. Clear? So out of this, which one of the following, when you notice, you have to immediately report to the physician? Oozing around the IV site is indicating a sign of bleeding. Tender uterus, that is a quite common thing in abruptio placenta. Hard abdomen is also a sign of abruptio placenta. Vaginal bleeding is also expected in abruptio placenta. But which one is more serious in terms of abruptio placenta? That is oozing around the IV site, because that is indicating DIC, disseminated intravascular coagulation. So where that is expected as a result of abruptio placenta. So you have to inform regarding this particular sign to the physician so that she or he can manage well. Clear? Okay, moving to another question. Which statement is true regarding abruptio placenta? So you have to select the true statement in terms of abruptio placenta. This condition occurs due to an abnormal attachment of placenta in the uterus near or over the cervical opening. That is something related with placenta previa. So A is wrong. And what B says? Marginal abruptio placenta occurs when the placenta is located near the edge of cervical opening. That is indicating marginal placenta previa. It's not marginal abruptio placenta. Nursing intervention for this condition includes measuring the fundal height. Can be. And fetal distress is not common in this condition as it is placenta previa. No, abruptio placenta is something different than placenta previa is something different than abruptio placenta. Fetal distress is considered as a common complication or a side effect of a client with abruptio placenta. So what is the true statement in terms of this abruptio placenta? It is nursing intervention for this condition include measuring the fundal height. Okay, so the answer true statement regarding this is C. Why A considered as false? Because it is indicating placenta previa. Even B is also indicating placenta previa. And C, how C is a positive thing or a true statement, because we have to check fundal height in terms of abruptio placenta, because that gives you a clear picture of how much blood get accumulated in the uterine cavity. Fetal distress is not common. That is a true false statement. It is common. Clear? So the answer is C here. And next, one more question I'll discuss. A woman who is 22 weeks pregnant. Oh, this we did. Okay, 22-year-old female who is 33 weeks pregnant with her second child has uncontrolled hypertension. What risk factor below found in the client's health history places her at a risk for abruptio placenta? So, what is the risk for developing abruptio placenta? So already the female has hypertension, uncontrolled hypertension. Uncontrolled hypertension during pregnancy is considered as gestational hypertension. So gestational hypertension causes abruptio placenta. Okay, and it causes preeclampsia and eclampsia. So which risk factor below found the patient's health history places her at a risk for placenta previa? That means, I'm sorry, it's abruptio placenta. So what risk is considered as a major contributory factors for developing abruptio placenta? It is gestational hypertension itself. It has two-phase preeclampsia and eclampsia. So the answer for this question is second one, it is preeclampsia. Okay, so we will practice more and more questions in the next video.
This is the major difference between abruptio placenta and placenta previa. And we will discuss one more condition in the next video. Thank you. God bless you all. Bye bye.